Hello and welcome to this lecture of Chapter 3, Prenatal Development and Childbirth in Life Course, Human Development. This is kind of different, not having an audience that I can see as I give this lecture, so hopefully it'll go well for all of us. So, Prenatal Development and Childbirth, we will first start off by talking about what the experience of pregnancy is like for the woman. This can be a happy time, but again, it could also be a challenging time. I know, for example, my wife has had a couple of summer babies, and being pregnant during the summer was absolutely miserable. I've also had some friends that have experienced that as well. Particularly as it's been so hot and humid here recently, climates like that can really be miserable. Can make them very hot, and I think it would be horrible, that part of the experience. Just kind of empathizing there. So if any of you have had kids during the summer or have seen a woman who's pregnant during the summer, you know that it can get quite miserable and very hot for them. But it can be a happy time as well. It can be exciting for the woman as well as for the couple in general. Some of the things that are going to determine whether or not it's a happy or a scary time are listed here on the PowerPoint. So, for example, how the decision for getting pregnant was made. So if it's an accident a couple wasn't intending to, for some couples that can be a very scary experience, and it presents them with a lot of challenges and decisions that they need to make. For some couples, even if they're not planning it, it can still be an exciting time for them, and they welcome the pregnancy just fine. And then couples that are planning to have a child or have been trying to have a child, for a while or even for a short period of time, the news of being pregnant can be a very exciting thing for the couple in general, but for the woman in particular also. Also, current and impending lifestyle changes. So, how stable is their lifestyle? Are they at a point where they feel like they're going to have time to devote to the baby? Financial resources are also going to play into that as well, and are also going to be related to the lifestyle. Raising a baby, having a baby is not a cheap thing. It's quite expensive. When I talk to new parents, they're always surprised at how expensive diapers are and how many you go through, particularly for newborns. Diapers are very expensive. When our last child was potty trained, my wife and I just totally celebrated because we're not going to have to buy any more diapers, let alone the process of changing them is not very pleasant. But not having to buy them is also a very happy and exciting moment in your couple's life. The woman's relationship with other people, how supportive are they? Are her friends and family supportive of her having the baby? Are they critical of the fact that she's having a baby? All of those things really are going to play into, how she feels about it. Her self-image, for those of you that have never seen a woman who is pregnant, they do get a large tummy to hold the baby in. For some women, this is okay. For other women, this can be really devastating that they feel like they're larger, feel like they're fat. So a lot of that just has to do with their self-image, how they view themselves. One thing that's nice in current times compared to when my wife and I were having children, the image of being pregnant is a lot more accepted now. And this is even reflected within the maternity clothes. For example, when my wife and I were having our oldest son, and even our daughter, well, you could probably even say all four of our kids, the idea or goal was to try and hide the fact that you're pregnant, and so the clothes tended to be baggy and did whatever they could do to hide the fact that they were pregnant. And the styles now, we've noticed, it's so much better because it appears that women can embrace the fact that they are pregnant, and the maternity clothes even reflect that. They have different ways of kind of showing off the belly. and it can be a real exciting thing for people to be able to embrace that. Again, I think that is a huge step in society that we've taken, that we no longer try to hide it, but we can embrace it. And you can even see a lot of people choose to have pictures taken during pregnancy where the belly is exposed, because it is something for couples or for women to be proud of, not necessarily ashamed of. And again, that's going to depend on the context of the pregnancy as well. And then there are definitely some hormonal changes that take place as well. Along with those can come things like morning sickness, which if a woman does have morning sickness, it typically lasts about 3 months, but it's not unheard of for it to last even the entire pregnancy. The woman can feel very ill, very sick, nauseated during the pregnancy. Hormonal changes, I already talked about how women who are pregnant, they tend to feel very warm and hot naturally. Their metabolism rate tends to increase, and they're also growing a human inside of their body, and so all of that is going to cause hormonal changes, which can be a downside or a miserable part of being pregnant, but again, it could also be a very happy time as well, even with the hormonal changes. So really all of those things, and probably a lot more that aren't listed in the text or on this slide, are going to influence how the woman tends to experience pregnancy. Now for the man, over the past 30, 40 years, men have become more involved in the pregnancy and childbirth process. It used to be that when the woman went in for childbirth, the husband stayed outside. And we see this sometimes in old cartoons or movies where the dad is pacing frantically back and forth in the waiting room. And then when the doctor comes in and says, "Congratulations, it's a son or daughter," he passes out the cigars or whatever. That's how it used to be. Nowadays, men are definitely more involved in that. Some couples will take childbirth classes together where they'll learn how to breathe, or they'll learn how to take care of the baby together. Men can go to all of the prenatal visits. They can be there for the ultrasounds. So all of those things allow the man to become more involved, and I think that's a good thing. Particularly as we go on in the class, we'll probably talk about how the role of fathers is really important, and as a society, we're starting to recognize that a lot more. Definitely have a lot further to go with it, but we definitely, again, have come quite a long ways. The emotional reaction for men, they're similar to women. There can be some excitement involved with it. There can be, worrying about being able to be a father, particularly for those men who haven't really had a father figure growing up or through their life. That may be a cause of apprehension, that they're not going to know how to do it, or they don't want to make the same mistakes their fathers did by abandoning them or abusing them. And so that can be a real source of worry for men as they're entering in that. I don't know that a lot of men really are afraid of the fact that they have to grow up now. I think most of a lot of that fear and worry really is going to be of how they're going to be a father. And then there's also some worry about their partner. When my wife was pregnant with our oldest, with our son, she got toxemia toward the end of her pregnancy, which raises blood pressure and can be fatal if really serious for both her as well as the baby. And so the doctor had to keep a close eye on her blood pressure to make sure things were going okay. And then when she got to a certain point in the pregnancy where our son would be okay, they actually induced childbirth so that our son could be born, and so that she wouldn't have to worry about any later stages of toxemia. So there are things that the husband does worry about. I definitely was worried about my wife during this, and even after birth with our oldest son, her blood pressure dropped to like really super low. And, I was watching the nurse scramble around the room trying to get her to blood pressure back up. And that was a very, very scary experience for me. I thought for sure that I was going to lose my wife. And I would not have been happy about that, just having that loss. The father's presence is so important throughout the experience of pregnancy and childbirth, really to just feel a part of it. So, still traditionally, fathers can cut the umbilical cord. Some hospitals will allow the father to be there for the child's first bath and can even give that bath to them. But it's very important for the father to also start bonding with the child. Contrary to popular belief for both mothers and fathers, there isn't necessarily a real instant bond with their child. This can take, a little bit of time to develop, just like anything else. So it's glamorized on TV and the movies quite a bit, but in reality, it can take some time to really develop that bond between the parent and child. So some parents might freak out a little bit about that, but that's not necessarily the case. But it is important for the father, to be there and involved as much as possible throughout that process. It's just a wonderful experience to be a part of. Okay, so prenatal development. So the first few stages there, the germinal stage is conception to about 2 weeks. So this is where really, you're not going to recognize it as a baby. It's just a bunch of cells that are dividing and dividing. Embryonic, somewhere within the first 2 weeks to 2 months, is the embryonic stage. This is where it starts taking shape. So it doesn't necessarily look all that much like a baby or a human, but it now has a shape. It's more than cells. Around the 3rd month to birth is the fetal stage, and this is where the baby starts looking like a baby, like a human, and the development continues on from there. The age of viability is about 24 weeks. This means that if a baby is born about the age of 24 weeks, they have a 50% chance of surviving. This used to be a lot lower, particularly in terms of the damage that can happen to a baby if they're born premature. Luckily, with a lot of our medical advances, it's a lot safer now, although I don't recommend it. But children can survive younger and younger than what they used to. I have a niece who was born 3 months premature, and this was back in the 80s. Not a lot of knowledge about this on the medical end. She ended up coming out with real severe brain damage, as well as being deaf. So even now, she's in her mid-20s, still really only operates at about the level of a 4 or 5 year old. I don't know if things would have been different had she been born during this day and age as opposed to the 80s. But back then, they just didn't know as much as we do now. So things are getting better, although it's obviously still preferred that the baby go full term or as close to full term as possible. Around the age of 25 weeks, there's a 75% survival week. So you can see just what a difference 1 week makes. And even here, 3 weeks, 25 weeks to 28 weeks, over 90% survive. So really, the longer, obviously, the baby is able to be in the womb and developing, the better for the child. But luckily, we have these means in the medical field to help babies who are prematurely born for whatever reason. So some of the things that are going to affect the prenatal development, the maternal age, women that are too young, so in their teens, or I shouldn't say too young, women who are young and women who are older, such as the age of 40 and above, are at a higher risk pregnancy than those around in their mid-20s, early 30s. Mid-20s, early 30s really is kind of the prime span for childbearing. But again, with our medical knowledge, it's not necessarily going to be a bad thing on if a woman is above 40 or in her teens. So again, thankful for our medical science, but again, that mid-20s, early 30s is going to be best. Maternal health and nutrition. You'll probably see women that take their prenatal vitamins as soon as they find out they're pregnant. We know things like folic acid really helps facilitate the development of the baby in the womb. So it's important for mothers to make sure that they eat and that they eat well. There is going to be some weight gain, even outside of just having the baby and all the water and everything, because the mother really needs to make sure she's getting enough calories, and more than just the calories, really needs to be able to get that nutrition. Poor nutrition and maternal health can cause lower birth weights and also can reduce brain development. So again, it's important to get that prenatal health care as soon as the woman finds out that she's pregnant, for her or the couple to go visit the doctor right away and start monitoring their health. It's for their benefit as well as for the benefit of the baby. Teratogens are those things that can be dangerous to the developing baby. So anything from the environment, from the mother, from substances that can cross the barrier from the mother's bloodstream into the infant. Now the placenta really is kind of that filter that blocks out a lot of things, but we know that some things definitely seep in. So viruses, who are they're a lot smaller than bacteria, they can slip through that placenta and into the baby. So things like getting the flu can be harmful depending on where the baby's at and how serious the flu is even. So it's not necessarily a scary thing, but something to just be aware of. Prescription and over-the-counter drugs. Always need to check with the doctor and pharmacist to make sure that things are, all of the medication that the mother is on is going to be okay. I will also put on Blackboard a podcast that you may want to listen to about medication and pregnancy. It's actually it's not really scientific. It's from Snap Judgment, so it's actually pretty funny, but makes you think a little bit too. Back in the old days, there was a drug called thalidomide that pregnant women would use to reduce their morning sickness and their feelings of nausea. And what they found out, though, is that drug causes birth defects, and there were babies being born without limbs, without fingers, toes, and things like that. So I always need to make sure with a doctor, pharmacist, that things are going to be okay. Obviously, alcohol, tobacco, and drugs are also going to be pretty damaging to babies, just in general. My niece, who was born 3 months premature, actually was a result of fetal alcohol syndrome, as well as tobacco. Tobacco can reduce, birth weight. Alcohol can be very damaging to the brain as it's developing. You've probably heard of fetal alcohol syndrome. And that can be very, very problematic for the child throughout their life, with the different symptoms and things that they struggle with fetal alcohol syndrome. Drugs also, it's going to be bad for anybody, but it also crosses that placenta barrier and can affect the baby. And then finally, environmental pollutants and radiation also can go through. To some extent, the mom might not have a lot of control over some of this, but with radiation, they're not going to do any x-rays or anything like that with a woman that's pregnant, at least not without a lot of lead around that to protect the baby. and just to be aware of those environmental pollutants, and if there is anything that a woman can do to avoid that, the more avoidance, the better. All right, so childbirth. So the initial childbirth, this initial stage happens when contractions are about 15 to 20 minutes apart. So once the contractions start, it's good to start timing them from beginning of contraction to beginning of contraction to see how far apart they are. Some women will experience what you've probably heard of false labor. It's also called Braxton Hicks contractions. These are kind of feel like the labor pains, but they're not. They can be a very normal part of pregnancy. Labor and delivery starts to happen when the contractions last longer, and they also become about 2 to 3 minutes apart. Now, you'll hear two terms related to this. You'll hear dilation, and you'll hear effacing. Dilation is basically how wide open the cervix is getting, and that's usually rated on a scale from 1 to 10, and it's basically done by centimeters, so about the width of your finger. They can tell. They can put their finger up on the cervix and see how open the cervix is. And effacing is how thin the cervix is getting, and really the effacing is what's more relevant in terms of when it's time to push the child to begin pushing with the baby. The effacing, again, is how thin the cervix is getting, and that's usually done on a percent. And there's not real science to this. They don't look in there with a ruler or anything to measure. It's just kind of a sense and based on the experience of the doctor in terms of when it's time to start pushing. So when contractions are long and 2 to 3 minutes apart, when the contractions happen, they'll have the woman start pushing the baby out. Eventually, crowning happens, and crowning is where you can see the top of the head of the baby, that it's about ready to come out. Sometimes if the vaginal opening is too small, the doctor might perform what's called an episiotomy, which is where they will take some scissors and just make a little cut along the vagina so that the baby can slip out a little bit easier. Sounds painful, but as I understand, it's better than having it ripped because the opening is not big enough. Most women, I think, do have to have some sort of episiotomy within their pregnancies, particularly if you're going to be have a hospital birth. That's probably going to happen. So birth, when the baby comes out. The baby comes out, and they clip off the umbilical cord, and then it's cut. And then after the birth is a recovery period, which really can take quite a while. For most of the women that I've known that have given birth, usually have a real burst of energy afterward, but after a day or so, it just really wipes them out. There is a lot of bleeding involved for women. That is not unusual at all. In fact, the pads that they provide them to stop the blood are really super thick. They're almost like a diaper, but there is a lot of bleeding that takes place after delivery. And then finally, after birth, after the umbilical cord is severed and the baby is either given to mother or father, the doctor actually just kind of pulls gently on the umbilical cord that still goes inside the mother that's hooked to the placenta. And as they gently pull, the placenta comes out as well, and they put the placenta in a tray, and then the doctor kind of pokes and prods along it all over to make sure that it's intact and that it's all there. If any remains within the uterus, they have to go in and remove that, because that can be dangerous for the mother to have that. So the afterbirth is extremely important for the mother. And that's about the gist of it. That's the nitty gritty without showing an actual video. So hopefully that makes sense. I know online there are a lot of birthing videos. So if you're curious, you can just get on YouTube and search for that, and you'll be able to find the video of your choice. So some of the things that might go wrong within childbirth. Now, I don't know. In my experience with all of the people that I know, some of these things really aren't all of that prevalent, but they do happen. So the cesarean section might happen if the woman has had to give birth previously by cesarean, and this is this is making a cut in the stomach through the uterus and having the baby be born through that cut, as opposed to having the baby be born vaginally. Sometimes an emergency C-section will need to be performed if the baby is just too large and it's stuck. It's not going to be able to make its way out for whatever reason. Then cesarean section might be called for. And sometimes if the baby is born breech, so they're trying to get their butt out first instead of the head, that may also call for a cesarean section as well. Once the baby is born, they rate the baby based on the APGAR scoring system. So either get a 0, 1, or 2. 2 is the healthiest. 0 is pretty scary. So they look at the pulse, so the heart rate, the breathing rate, the muscle tone of the infant, the reflex response, and then the color of the baby. And they rate it on that scale of 0 to 2. So you can see the scale there. And then finally, premature birth. We talked about some babies might have to go into an incubator where it's somewhat mimicked as though they're in the womb, although they're not. But they try and provide everything for the baby to help them survive. And we talked about the survival rates of babies that are born premature. All right, so the baby, the trauma of being born. The baby's head gets squished. Their skull hasn't completely fused, and that won't happen completely for a couple of years. But their skull is basically flattened in areas in order to get that head through the opening. So that would have to be fairly traumatic, I think. And also going from a very warm, dark, calm environment out into a light where it's now cold, and you're being handled all over the place. I can't imagine that as a very pleasant experience for the baby. Luckily, I'm guessing probably none of us remember that experience, but probably because we repress it because it was just so traumatic. So size and appearance, we talked about the APGAR scoring. So some reflexes that they are born with, breathing, that's a good thing. Rooting and sucking are also reflexes, coughing, sneezing. Some of the primitive startle reaction, probably don't recommend testing that on babies. The palmar grasp, when you put something into an infant's hand, it'll automatically close on it to grasp it. Rooting and sucking has to do with feeding, so breastfeeding or bottle feeding, whichever happens. But as soon as the baby is born, that really is where the beginnings of attachment starts to take place. And the attachment, again, happens for the baby as well as for the parents. Responding to the baby's needs, doing those sorts of things. That's really where it starts to begin having that connection with the baby. So that is prenatal care and childbirth. We'll pick up next time with infancy. If you have any questions, please feel free to contact me. And thank you.